Crohn's disease diagnosis details to know. A Crohn's disease diagnosis is due to an illness that consists of chronic inflammation of the intestinal walls and other parts of the digestive tract. It leads to symptoms such as diarrhea, abdominal pain, fever, etc. Inflammatory bowel diseases. Inflammatory bowel diseases, IBD, are characterized by chronic inflammation of the intestinal wall that has non-specific origins. And they present in recurring fashion. Two of the big ones include ulcerative colitis and Crohn's disease. First, ulcerative colitis affects only the mucous membrane of the intestinal wall. On the other hand, a Crohn's disease diagnosis applies to the entire thickness of the intestinal wall and all of the bowel segments. However, it often does so in a segmented and asymmetric way. Additionally, the cause of the illness is not known for certain. And the most widely accepted theory is that it has many factors. Or, in other words, a Crohn's disease diagnosis is the result of genetic, environmental, microbiological, and immunological factors. Symptoms that lead to a Crohn's disease diagnosis. Diarrhea, normally bloody abdominal pain, increase in size of the abdomen, weight loss, tiredness, tenesmus, fever. Crohn's disease can give way to complications such as abscesses, fistulas, intestinal obstructions, stenosis, perianal disease, toxic megacolon. Crohn's disease diagnosis has also been linked to a predisposition to colon cancer. However, studies are not conclusive due to the unknown origin of the disease. Extraintestinal manifestations. Related to the degree of activity. Peripheral arteriopathy, erythema nodosum, episcleritis, ulcerative stomatitis, fatty liver. Independent of the degree of activity. Pyoderma, gangrene, psoriasis, ankylosing spondylitis, uveitis, and sacroileitis. Diagnosing Crohn's disease. A diagnosis of Crohn's disease relies on clinical and histologic data, laboratory tests, and endoscopic and radiological tests. However, there is no one specific test that will diagnose the illness. Celiac disease and intestinal infections would need to be ruled out. This is because both can result in inflamed mucous membranes. A lack of an effective test for detecting Crohn's disease can lead to a significant delay in diagnosis. Endoscopy. An endoscopy is used in the initial differential diagnosis. So, this helps determine how far it has extended, and the severity of the damage. Additionally, it determines the presence of neoplasm to evaluate the response to treatment, and as a treatment method, in some cases. The ileocolonoscopy is the preferred test for initial evaluation before a Crohn's disease diagnosis. Imaging. Different imaging studies are done. These include upper GI, ultrasound, CAT scan, and MRI. Imaging helps detect edema, ulcers, stenosis, fistulas, and extraintestinal problems. Histology. A biopsy can be very important in the differential Crohn's disease diagnosis. Some of the main related characteristics of Crohn's disease are: granulomas, lymphocytes, irregularities in the intestinal wall. Laboratory tests. First, doctors will administer a call-protected test. Then, this will determine if there is intestinal inflammation or not. It has to do with whether this protein is found in the stool. Classification of a Crohn's disease diagnosis. Patients are classified according to the age at which the disease began. Also, the location of the pathology, and the behavior of the illness, according to the Montreal classification. A1, less than 16 years old. A2, from 16 to 40 years old. A3, 40 up. Location. L1, ileal. L2, colonic. L3, ileocolonic. L4, isolated upper disease. Behavior. B1, non-stricturing, non-penetrating. B2, stricturing. B3, penetrating. P, perianal disease modifier.